All right, a warm welcome to you from Geneva, Switzerland. I'm Breda Satki, and next to me, for the first time ever, is Dr. François Gasse, our guide on the side for these experience sharing sessions. You know, the principle is that as you work this week, many of you, most of you are finished with your, have submitted your action plans for IA2030. We'll be kicking off on Monday, the 23rd, with what we call the Impact Accelerator. For some of you, it will be the third time that you are committing and participating to the Impact Accelerator. For others, it will be the first time. We want to make sure that you find your way and understand what is going to happen. So let me just turn off the join and leave sound. And we are going to need a volunteer. So we like these experience sharing sessions. It provide a way for us to have the small group discussion that we simply cannot do in the assembly. So first question will be, if you wish to present your action plan, will be to right at the here will be to share your challenge, your objective, and then summarize your corrective actions. If you'd like to share an experience, that's really up to you. We want to make sure, as you think about what you want to share, that you're able to summarize it so that colleagues who may know nothing or very little about your situation are going to be able to understand it. And so we are going to need a volunteer. So to find the raise hand button, most of you should know by now how it's done, but you go to the reactions and you'll be able to then see an item that says raise hand. Let's go to Atta here.
Okay, good morning, good afternoon, good evening, depending where you are. Atero Obakar is my name. I'm supporting Zamfara State Primary Health Care Board on routine immunization as a freelance person. My priority challenge is poor conduct of outreach in security compromise and hard to reach areas of Zamfara State. Everybody knows that in the northwest of Nigeria, we have armed bandits that have been disturbing that area for quite a long period. So, but for now it is reducing, and a lot of children there have not been immunized. So most of them has moved from the village to the hinterlands around Gusau, the state capital area, and some part of the states where the security challenge is not much. So the objective of my action plan is to seek a funding for outreach to healthcare providers in Zamfara State so that they can conduct outreaches. There's a basket fund where each LGA will provide. Can you go back to my previous slide? Sorry. There's a basket fund where each LGA contributes a monthly basis to the state. So will they provide support to the primary healthcare board to conduct immunization and other PHC services? So that's why I want to have a discourse with the state, advocate to the Minister of Local Government and Chieftaincy Affairs, Ministry for Finance, and the State Minister of Health, so that fund can be allocated for outreaches in those areas. And then I can answer the next slide.
Thanks, Atahir. So that's very interesting that you've chosen to focus on your action plan, on actually essentially fundraising for the actions you want to carry out. So I'd like to invite participants, members of the movement, fellow members of the movement, to think about, in your experience, can you think of a time when you were successful in raising funds, raising resources for an action that you wanted to do, perhaps an action similar to Atahir's, but perhaps very different? If so, then I'd like you in turn to raise your hand, and we'll come to you once Atahir has finished describing his corrective actions and telling us a little bit about his indicators. We'll turn to those of you who have that experience to tell us, what you did and how it turned out. So Atahir, next, could you summarize for us the 3 corrective actions that you've chosen to focus on in your action plan, knowing that this can change and evolve as you actually carry out the actions, but how are you going to go about securing these funds that, if I understood correctly, are available, but you need to go through steps to get them?
Yeah. what are the three corrective action I have started taking? First of all is for the Ministry of Local Government and Chieftaincy Affairs, who are the custodian of the basket fund, to understand the importance of immunizing those children in hard to reach and compromised areas. Because if they don't know the importance of immunization, the fund will not be released. Secondly, is for the healthcare workers to develop an outreach plan to capture those areas that we know is security compromised. And the third action is to liaise with the security. Some of the securities have been trained on immunization conduct. So those are the three corrective actions we are planning to do.
So can you repeat
we have started the advocacy
action at here?
Sir?
Can you repeat the third action, please?
Okay, the third action is to involve the security personnel who are in those areas, because we have to involve the both local and the state securities who are there in that area to give support to health facilities. Otherwise, going there will be exposing the healthcare workers to them. So that's what we have done. We have carried out so far.
Yeah. Sorry, are these actions you intend to take, or you're saying that you have already done some of these things? Is that correct?
We have started the advocacy, the Ministry of Local Government and Chieftaincy Affairs, with the access to go and do a budget for the activities. So now what we are doing is we are conducting a micro plan of those areas so that we can do this like a census of how many hard to reach and security compromised area we have and what is the population of under 5 in those areas.
Okay, thank you, Atahir. There's already a suggestion from Boma Otobo who says so she is, as you know, the Deputy Director of NERIC, the National Emergency Routine Immunization Center in Nigeria, and she is sharing potentially something that could be of interest, could be useful if perhaps you already know that there's a partner breakthrough action, and even the new incentives can be approached with a proposal for the outreaches. And she asks, can you exploit these suggestions? And again, for everyone else, members of the movement who are listening to Atahir summarize his action plan, think about, do you have in your experience a time when you were successful in securing resources, funding? Are there any lessons learned that you'd like to share with him with respect to his action plan? And Atahir, for you, we've now come to the, we ask you to share some of the basic indicators. I'm not going to ask you, of course, to share all of them, but just to tell us of the indicators that we asked you to share as you defined your action plan, which ones matter with respect to what you're trying to do. So not the funding, but yes, the convincing the local authorities that this is worth doing, for example. Which indicators matter and why?
Yeah, the indicator that matters there is the phase 2 now are two very important. The target population to be vaccinated. We need to know those target population in those areas because it will help us in developing our micro plan. Then the outreach session to be conducted. How many outreach do we need to do so that we can reach our target population? Because without knowing those two, our plan may not yield, will not be positively yielded.
Thank you, Atahir. All right, I see Tekeste Dalke has a hand raised. So let's go to Tekeste Dalke. Tekeste, I'm asking you to unmute. And again, Atahir's action plan is focused on actually securing funding in order to carry out zero-dose work, if I understand, or reaching children that have not been previously reached or under-reached by immunization, let's say under-immunized. Tekeste Dalke, are you able to unmute? So we're looking here for members of the movement. Yes, Tekeste, go ahead. Don't forget to introduce yourself and tell us what is the experience you'd like to share with Atahir Abubakar from Nigeria.
Okay, thank you. I'm Tekeste from Ethiopia. I'm an immunization expert. I'm working almost for 10 years as a routine immunization consultant, especially working for UNICEF for the last 2 years. So I was the most serious challenge when I was working as immunization expert at the community or at the health expert level. The most challenge that as I took as an immunization agent action plan was serving those community in hard to reach areas, especially the pocket areas. So there are a number of children unvaccinated in those areas. So I prefer this challenge as the most, and I try to take an actions for on that challenge especially. So as an action plan that a goal that I took was to improve the immunization coverage at that area. This was as an action plan, as a goal, as an objective to improve.
Yes, Tekiste, can you tell us at what level of the health system do you work?
A level of health, zonal health level.
Okay, yeah, all right. And so can you summarize? So I thought you were going to share your experience about fundraising, but it's true you had your hand raised before. So again, for members of the movement, we're going to stop at 2 action plan presentations and really turn to the rest of the members to share their experience with respect to these challenges. So Tekiste, can you summarize your corrective actions? What is it that you're actually going to do, carry out? And could you tell us about?
So to improve this immunization coverage, vaccination coverage at that area, I just prepared to have first reestablish the API task team at that level. Secondly, using this task force, we'll have monthly review meeting to evaluate the key performance indicators, the challenge, what have been encountered at the community level, and what was the success story at that level. These are the 2 actions. The first one is re-establishing the API task force, and secondly, using to evaluate, to monitor this performance as a key performance indicator at the community level. We need to have conducting monthly review meeting with those API task force and at all levels.
And Tekiste, can you summarize how you think these 2 actions are going to help you progress towards your goal?
So because during our review meeting, all the stakeholders come up with their key performance indicators, which they are performing at the community level. So during that meeting, we evaluate their performance, what were their challenges, and with the feedback at the community members, by each indicator we evaluate at the field level. So with this, we can evaluate and we can monitor them. And at the end of the day, we can see the results and even the achievements, what they have performed at all levels.
Thank you, Tekiste. And I have an additional question for you. How old is your child or baby that we can hear in the background? And is this a boy or a little boy or a little girl?
What, pardon? Sorry?
I thought I heard a child in the background, perhaps a baby.
Yeah, that's why there's a child.
Is that your son or daughter, or is that?
It's my daughter, yeah, sorry.
Okay, all right. I have a little 3-year-old daughter too, so please, so glad that she is part of the conversation. All right, thank you, Tekiste. So we've heard 2 action plan summaries. Let's go now to June Ojukwu, who has her hands raised. So now we're not going to be asking anyone else to present their action plans, because we do want to ask members to challenge you to share, think about the experience that you have, and share something that you think would be useful to either Attahir Abubakar or Tekiste Dalke. Attahir, you do have a comment from Mohammed Nasir Umar, who says, great action plan, Dr. Attahir. What other interventions can you leverage on without the funding? There's an ongoing COVID-RI integrated micro plan, and there's an effort to NPSIA's polio campaign, COVID and CES. How do you plan to use these opportunities? So I suggest, Atahir, that you answer Mohammed in the chat, so we can hear from June Ojukwu. I've asked June to unmute. Let me see, there are more hands raised. So let's go to Usman Maikaita and Dr. Karo Shah Sayed, Melise Teferi.
You want to Switzerland? You want to start the
All right, June Ojukwu. Yes, so welcome to you. Please introduce yourself, tell us who you are, where you work, and then tell us what is the experience that you'd like to share with either Tekeste or Atahir.
Okay, thank you for the opportunity. My name is June Ojukwu. I work for Momentum, USAID Momentum in South Sudan as a community service delivery advisor. So in my job, I work with the community and implement the RECRET guideline in the community. Yeah, so based on what was being discussed, it's like for me, the most important thing first, when you secure a fund is the micro planning, because micro planning can like give you what is in the community, which sites are missing with the vaccination, what will you be doing? So after the micro planning, you now do the mapping. You map the place for the outreach. So when you map the place, now based on the micro plan findings, then now you involve you do community meetings. You do community meetings. After community meetings, you tell community what you are going to do and how you are going to do it, so that the community leaders will also support you in mobilizing those zero-dose children and the defaulted children. Then after doing the mobilization, during the outreach, you make sure you either conduct, if the fund is not enough, you do integrated outreach. Like for us in Momentum, we have a family planning, we have MNCH fund. So like if you integrate immunization with those one, it will also be successful, because you cannot go immunization alone. You take nutrition with you, you take the other MNCH services for ANC, and also other service like for malaria and distribution of mosquito net, like this, because in our country, because the countries are like a fragile country, so you will find like people mostly come for service when there is like food ratio. Like in case of nutrition, if there is nutrition, people will come many, but if you put immunization alone, people will not come. So you do integrate with other services that people like most. You look for other partners also, so that you work together. So I think this is all from my side. Thank you.
Thank you very much, June Ojukwu. We'll be going back at the end of the session to Melise and to Atahir to ask them, is the experience that was shared, is it useful to them? But thank you for this contribution. Let's go next to, I believe it was Dr. Koraro Shasayed. And then we also have Dr. Sikandar Ali Sumru. We have many hands raised. We will, at the half-hour mark, that marks the formal end of the session, we will go through the ritual of asking you if you'd like to extend the session, and only if participants in the room say yes, will we together. François has already agreed, yes, and so have I, that we'll extend the session if this is what participants wish for. So let's go to Dr. Yes, Sikandar Ali Sumro. Yes, please remind us who you are and what you do, and then tell us what is the experience that you'd like to share with either Atahir or Melise.
Yes, sir. From Monday, we are going to celebrate the polio campaign. That's why I want to share my experience today. Yes, my name is Dr. Sikandar Ali Sumro. I am working as a focal person in SIS as well as EPI. I am a senior medical officer and as well as additional medical superintendent in Sub-District Hospital Shikarpur, belongs to the health department. I want to share my experience.
You are from, Dr. Sikandar, you are from Pakistan, is that correct?
From Pakistan, yes, from Pakistan. So I want to share my experience. I have 23 years of working in immunization field. What I have observed during my last 23 years, that I have seen most of the caregivers, they are hesitant. They avoid the injectable vaccines in here in Pakistan. Not only the routine immunization of the child below 2 years of the age, government of Pakistan is injecting routine immunization antigens below 2 years of age, as well as COVID vaccination up to the age of 60 years. So most of the people in here in Pakistan, they are avoiding the injectable vaccines, not avoiding the polio vaccine nowadays. Few families, negligible people are avoiding the polio vaccine, but most of them are avoiding the injectable vaccine, injectable antigen. So this is the biggest problem in Pakistan, hesitant and the refusals of immunization. Mostly there the root cause of this is illiteracy or unawareness. No doubt, not only the literacy and awareness, but inadequate, mostly the poverty and the lack of food security. Having not complying to the family plannings, they have a lot of people save a lot of childs in the world. So there's a food insecurity, sharing the plates with other childs as well. So lack of awareness of routine immunizations. And another factor or root cause is the fear of AEFI. So not only the fear of AEFI, there are religious hesitant as well. Lack of family planning is one of the cause of the here. Another most important population is the HRMPG. Moving people, migratory people, dispersed people in Pakistan. When they are residing here in one city, they are going. They are always moving on. So they do usually, if we are successful to inject one antigen, so they will become the defaulters, or they refuse for injectable vaccines in. Few of them are demanding. So here in Pakistan, if they are poor infrastructure, lack of insecurity, lack of job, poor political situations, so they are demanding as well. So we have a lot of root causes of hesitance as well as the refusal. So these are the root causes. So how we tackle these root causes or way forward, or what actions, corrective measures we are taking in Pakistan, try to convince these people to inject the routine immunizations.
Yep.
So we are trying to treat the
thank you for, I believe you summarized your situation analysis. Can you, so just two things, can you very briefly summarize what is your priority challenge and what's the goal that you've set in your action plan? And really what we're looking for is specific experience. So not the general situation, but something that you did, whether it was a success or a failure, but something that you did that you actually carried out that could be helpful to either Melissa Teferi or Attahir Abu Bakr, who shared their action plans.
As already I have told you, the actual challenge is the refusal caregivers. So what we have done here in Pakistan, we are trying to convince them by conducting advocacy, communication, not only social mobilization activities, sessions in the community, but we are trying to involve the local leaders, religious leaders, local population. We are trying to temporarily hire the people from that community to convince them, having local language.
Can you clarify for me what level of the system do you work at and where in Pakistan?
Yes, I am working here in a district.
Okay, understood.
Since Pakistan, from one district. So in the district, I have worked wholly in the district, but now I am working in a portion of the district. We have hired now 4 focal persons in our district. In spite of 1 focal person, we have hired now 4 focal persons in our four sub-districts, trying to involve them as much human resource. So we are trying to reach them as quick as possible. So we are now working, 4 people are working as a focal person district, our district. So we are trying to convince them that vaccines are safe, vaccines save their lives, vaccine prevents the people. So cure is better than the prevention. Prevention is better than the cure. So we are trying to convince them, we are trying to tackle these hesitance, we are trying to focus on their problems to convince them to inject the vaccine.
Okay, so can you tell us what is the experience, the insight, something that you've learned that you think would be useful to Attahir Abu Bakr or Melissa Teferi, who shared their action plans earlier?
Yes, sir. We have made a comprehensive micro plan by involving all stakeholders, including UNICEF, Gavi, ComNet, and all our N staff, all the health department, local departments. So we have been supported by all the stakeholders in NGOs, as well as the local leaders, as well as the local departments, to convince these people. But still we have the challenges because persons who are moving from here and there day by day. We have most of the defaulters. We try to convince them, inject them one injection, then they are going from here to there. So we have digital immunization as well. We have registered them in digitally. We are frequently giving their reminders. In spite of this, we have a lot of defaulters. So we are trying our best to convince them to inject this. Yes.
Thank you, Dr. Sikandar Ali Sumra. We're going to ask another, at least one more person before we reach the half-hour mark to share their experience. And again, what I'm going to do is I'm going to lower all of the hands that are up, because I know some of you were hoping to share your action plans, and there are other ways in which you can do that, I hope, with your IA2030 twin in the Telegram channel or in Monday's assembly. I'd like you to raise your hand if and only if you have specific experience in relation to the action plans that were that have been presented today, that you believe would be helpful to your colleagues. That is the purpose of sharing experience, which is not an end unto itself, but really a way of supporting each other in this movement for Immunization Agenda 2030. Michael Jones, the floor is yours. And don't forget to introduce yourself. You have your hand raised. Yes, Michael?
Yes, and good morning, everybody. I'm Michael Jones, and I am from Freetown, Sierra Leone, and I support the Child Health and EPI program of the Ministry of Health at national level. And key parts of my support is towards new vaccine introduction, and of which includes COVID and vaccine, and also related to the NOPV, which was newly introduced. And currently also I'm working on introducing the HPV vaccine, and for girls who are 10 years of age, and as a way to protect them for cervical cancer. So the plan is that we are planning to introduce HPV vaccine in September, October this year, and then wherein we want to target girls at schools, because 80% of the targeted population are found at school. And so this is much more of what I'm doing, and in terms of immunization work here at Sierra Leone. And
what is the experience that you'd like to share today?
So my experience I would like to share is in relation to when you're introducing a new vaccine, and what are the challenges that you face, especially when you are introducing a vaccine which is not within the routine immunization program, and secondly, which is not within the routine immunization age cohort. Okay, of course, routine immunization age cohort, we normally say 0 to 5 years. That's for children under 5. But for introducing a vaccine which is above that cohort, it requires a lot of things and lots of interventions, especially when the target population is quite different. Now, as we are saying now, we are trying to introduce HPV vaccine targeting girls at 10. And this is like a new intervention, a new age cohort, and requires a lot of integration in terms of working with MDAs that are dealing with that cohort that you are targeting. So for us here, what I want to share is that a key coordination with MDAs, ministries, departments, and agencies is very, very important. Now we are introducing the vaccine, working with the Ministry of Education gives us access to the schools, gives us access to the girls, especially when it's an issue related to consent. And you cannot give vaccine of that age code without having a consent. But using the school platform, the Ministry of Education platform, through the teachers, through the district structures and the heads of schools, gives the opportunity for them to communicate the information to the parents and seek consent from the meetings that they normally have. They normally have the parents-teachers association meeting. which the school will communicate this information to them and ask them for the consent to the introduction of this vaccine. The second thing I also realized that when you are introducing a new vaccine is the issue about the local stakeholders engagement. These people should be engaged, especially the tribal heads, the chief people who are working as chief or heads in these various communities. Because what you will see is that if in these communities, they do have their own bylaws and regulations, and they consider the tribal heads as their own authoritative heads, and they listen to them. If you see a tribal head go out and take a vaccine or say something about the vaccine, all of the people in the community will follow them, will follow what they are doing. And the third thing, we also notice that the issue about traditional healers is very, very important nowadays when you are giving a new vaccine. A lot of people, when they are faced with situation or they are faced with problems, they prefer to go to their traditional healers to seek redress. And if they go there and you have consulted the traditional healers, we have talked to them, we have engaged them, we'll tell them that, look, whenever they come to you with this type of things that they are facing, please refer them to the hospital, refer them to the clinic, and let them go for the vaccine. So the engagement with traditional healers was also very important. And the last thing I want to share is that for every targeted age cohort or age group you are targeting or beneficiary, it's nice to identify a champion among that group to lead the whole process. Once you have a champion, it's going to be the person who will spearhead the whole process, who will be the voice to speak to that particular age cohort or particular age group. And this will help in getting the acceptance within the district. Lastly, reporting of data, information is very important. Accurate, prompt data reporting is very important. Feedback needs to be given to the service providers. Feedback needs to be given to the nurses. Feedback needs to be given to the staff working at the facilities. And these are the experiences that I have gained that I think I would like to share. That whenever you give feedback, you keep the staff motivated to do more and to do, because you appreciate them and they see their performances and they know that, oh, we have to do more. This is good. And you acknowledge what they are doing. And once you acknowledge what they are doing, the staff will also be motivated to do more. And this will also improve your coverage. This will also improve of the staff going to outreach communities. And at the end of the day, you have your coverage being achieved with staff well motivated. So this is the experience I also want to share with people out there.
Thank you, Michael. I can hear, and I think we can all feel the passion in your voice as you describe these different things. My one suggestion for me would be to focus on how you are doing these things. What are the words you use to give us examples of how you are motivating staff, how you are making these advances when you share experience, because everyone will agree that these are good things to do. The problem is, how do you actually make them happen? But thank you, Michael, for sharing. We're actually past the half-hour mark, so we are now going to ask you if you would like François and I to extend, and all of us to extend this session. So if you would like to stay to continue the discussion, and if you'd like to hear, there are many hands raised, so if you'd like to hear the additional voices before we close this experience sharing session, go ahead and type yes in the chat. I have just done it because I would like this session to continue. All right, Atahir, who was the first to share his action plan, said yes. Sarwat, Melese, Michael, Martin, and of course, if you need to go back to your daily duties, work must and does come first. So we understand if some of you have to leave the room. Margaret, Dr. Sikandar, Dr. Martin. All right, so please, all right, Adamu, we need a few more yeses in order to justify continuing the session. So if you have not done so, but you would like it yet, okay, thank you, Annika. All right, let's see. We have, as I said, many hands raised. We're going to, I don't know, François, if you'd like to share a few thoughts or follow-up comments before we go back to hearing a final set of voices.
Thank you, and thank you for all the presenters. I think I'm going to focus on the critical things that have come from different, and combined, they give a lot of useful lessons. I think the first one was on raising money and to get to the outreach for the target population below 5. which I think the target population is extremely important to know, because I'm not sure how big is the target population, and any people funding will ask, how big is the population, how much money do you need, and have you got a micro plan, does it make sense? Before they can, you have your strategy, you know the groups that could fund it, you have an advocacy, but I think to be as precise as possible on the target group you reach, because I don't know if today your coverage is like 20%, is it 80%, and you're looking for the last 20%? So be very specific on the target group that you mentioned. The second I would like to stress is you can do outreach, but maybe the outreach will not give you the level of coverage you want. And we heard from the lady in South Sudan who have raised a list of very interesting points, saying that you need to know who are those communities, what are the specificities, when can you immunize them, involving them a lot in the planning to be sure, and training the leaders in make sure that when you come, all the people you target will come to the sessions. This, I think, is an extremely important, and not assume everybody will come because you have an immunization site. And many have said, I've raised the issue that people are, like in Pakistan, a bit defaulters, hesitant, etc. But I think focusing on quality issues to make sure there is a demand when you come, everybody comes through the interaction community, I think is extremely useful. What I also interested, one of the things which is critical in getting the job done is the follow-up that I heard. There was a focus on following up and making program review with critical indicators that you follow and you review. It was raised, and I think I tend to believe that everything is follow-up in life. And many ideas are coming, but very few are executed and followed up, and follow-up is critical. And I love the structure of the follow-up meeting, that's the lessons learned about looking at indicator, looking at the problem, the challenge, and what to do, and next month doing it again. This is really a good management approach to ensure effectiveness. I think the last point I would like to stress was about introducing our last speaker, about when you introduce a new vaccine, and he has highlighted all the challenge of introducing a new vaccine, and this time he's targeting girls with fertility issues that can pop up in, and working in concert with all the critical stakeholders. And that's extremely important. Ministry of Education, religious affairs, and local leaders. Without all those people around a table, you may not achieve high coverage. There will be a lot of different. I heard the word consent. I've seen many countries where the consent from teachers, from local communities, from the parents themselves, when they are not in, you fail your high coverage. So all those critical stakeholders need to be involved and give a consent. And this has shown some countries, and obviously it's going in that direction. So I wish the best luck with your work to get to this high coverage with a new vaccine introduction like HPV. Thank you.
Thank you very much indeed, François. Let's see, we have, so Dr. Sarwat Kadir, a reminder that this is to respond to the specific action plans that were presented, or to follow up on the sharing of experience. We also have quite a lively discussion, I believe, between a group of Nigerians and others in response to Attahir's that has been taking place in the chat. But Dr. Sarwat Kadir, please introduce yourself. Tell us who you are, where you work, what you do, and then what is the experience that you'd like to share. Please summarize and be brief, because we have other members of the movement who would like to speak and share their experiences as well.
Hello, hi. Am I audible to you?
Yes, loud and clear.
Okay. I'll take not more than 15 minutes. My name is Dr. Sarwat Kadir, and I'm from AJK, Azad Kashmir, Pakistan. So I've been I have joined the World Health Organization as a consultant training for COVID vaccination 1 year back. And as my contract has been ended, and I joined back Department of Health as I was a permanent employee of the Department of Health, Jammu and Kashmir, and I'm serving here for the last 12 years. Sir, basically, as this was totally separate field, I mean, as we used to see only the OPDs and indoors during our hospital and training tenure, that was only patient-doctor relationship and follow-up of the clients or patients. During last 1 year workup, as we have to go to field and dig out what is happening around on ground realities. As you know, in the field, we can see all the things, what is our health infrastructure, how things are happening or being managed. And also, as I was a training consultant, I will share some other time or in some other session what my experience is being the training consultant. The few challenges, as I've mentioned, my challenges in the annual action plan. Main challenges during the job, which I feel there are loads of challenges which I observed during that tenure. There are loads and loads of challenges, but the basic things for which we are working for is the vaccine coverage, to improve the vaccine coverage of COVID vaccine. I was not working with the routine immunization, but I was like looking after in my setup, my hospital setup, my centers, my basic health unit centers. I was looking after that routine setup, routine immunization setup. We are now, we have worked for COVID vaccination, but what I feel, if these, I was talking about the loads of challenges, what I feel that they all are interrelated with each other, starting from the very first point, like enhancing access to immunization services. What we did for this specific, that we worked with in coordination with consultants, with the government, we made it accessible to more than 100+ EPI centers, so that accessibility would no more be the issue for the people. What the main issue is nowadays, low vaccine coverage is the basic issue, and the main cause of this is, what I feel is, first, if we see if we see to the department side, there's a low monitoring and evaluation, low surveillance process. Surveillance system is very weak, what I feel. And secondly, the misleading narratives. As you know, vaccine hesitancy remains a substantial challenge for Pakistan and many of the other countries as well. So many theories against polio have been circulating. So against COVID vaccine, there are conspiracy theories that were being actively discussed in the Pakistan community through social media. And in the country where vaccine hesitancy is a prime barrier to curb vaccine preventable diseases, such conspiracy narratives may plant seed and resistance against upcoming, to improve the COVID vaccination programs. In this context, we share possible measures to neutralize circulating false claims against COVID anti-campaigns. So what I feel, I would, firstly, gave my technical support to the Department of Health in terms of different strategies, that how we can build trust for the public, as we need to confidence building. What are the confidence building measures? Trust in vaccine safety and efficacy, communication messages for the people. How can we approach to reach the hesitant groups, trusted channels, involvement of stakeholders? And I've been, from the WHO side, I've been a focal person, this was my extra charge, you can say, a communication focal person. I was the member of the communication task team being notified by UNICEF, by government, with the help of UNICEF and JPIGO, as you know, John Hopkins affiliate. And I was a member from the WHO side in that communication task team. And we did a lot of measures to deal with. And JPIGO is nowadays working on the document and working for this, specifically nowadays working for the COVID vaccine, to improve the vaccine coverage by communication, improving communication system. But they will definitely work in the long run, they will work for epidemics, outbreaks, for other vaccine preventable diseases. What I suggested, as I gave that strategies to improve the vaccine coverage, the main important thing, as you know, lady health workers, the participation of lady health workers. Basically, I don't know from where to start and where to end. I have many challenges in my mind. I have the shortage of time. So what the main thing,
Kadir, I'm going to interrupt you because Melissa Teferi is asking you, what is the main challenge? There are many challenges, but which one have you chosen as your priority for your IA2030 action plan?
Nowadays is a low vaccine coverage of COVID vaccination, and there are a lot of challenges. I told you, they are interrelated with each other. If people are not taking vaccine due to accessibility, due to equitable measures, due to they cannot reach the vaccine accessibility, as I told you, and the wrong messages. We are dealing with misleading narratives. I have told you this thing. So the thing is basically low vaccine coverage. But the main what we are focusing on that. Okay, how can we approach to reach the hesitant groups? How can we involve the stakeholders to support us to improve this low vaccine coverage? So what I suggest, according to my point of view, sir, we have lady health workers of national program here in our, I guess they cover 60% of the areas of Azad Jammu and Kashmir. And 40% is uncovered, but they cover. And one lady health supervisor have lady health workers 25, and one lady health worker covers more than 1,000 population. So one lady health supervisor covers more than 25,000 population. What I did, that as a participation of lady health workers who work at the grassroots level to promote healthy behavior, they can promote healthy behaviors and provide basic curative services, and also act as an agents of change through social mobilization and changing behaviors of people at community levels, ultimately improve the quality, coverage, and equity regarding the immunization process. I shared the templates to track the defaulters in their area, in their respective areas, and definitely it will also in turn improve the quality and coverage of their areas. And also, we have also had sessions with the stakeholders. As you know, our beliefs are very tied with the religious beliefs. So we have involved mainly educational sector and religious leaders in our this communication task team. We had sessions with them, and because I'm working, as I told you before, that I moved back my Department of Health, but because I'm working in this setup and in touch with this whole system, so that I'm putting my efforts so that I can make a difference.
Thank you, Dr. Sarawat Kadir. I see many more, again, a lively dialogue going on in the chat. And Dr. Kadir, I urge you to look at the questions that are being asked by fellow members of the movement, such as, what is the root cause that you identified? As well as the question I mentioned, which is what is the main challenge that you are going to address? If you have submitted, I am guessing that you are new to the movement. There are over 2,000 new members to the movement who've joined in the last 3 weeks, who said, at least said they wanted to develop an Immunization Agenda 2030 action plan. I hope that you have already submitted yours, and look forward to seeing you.
I've already submitted it.
Okay, wonderful. And look forward to seeing you on Monday when we hold the Global Assembly, which is the one time during the week when everyone is together to share experience and support each other in making progress against these many challenges. I want to see if there are any last. Okay, I see Mariam Idris is a very active member who's been with us since March, and I'd like to maybe ask her for closing words before we hear. Before we bring this session to a close. I know she struggles with connectivity. Mariam, are you able to unmute and speak to us? We'd love to hear from you. And we are closing this session, so we'd just like to know really how you are doing and if you are ready for the Impact Accelerator.
Hello? Hello?
Yes, Mariam, we hear you. How are you doing? And are you ready for the Impact Accelerator?
Good morning, everyone. I'm Mariam Idris from Nigeria. Hello? Saying hello? Are you hearing me?
Yes, Mariam, please go ahead.
Are you hearing me?
Loud and clear. Please proceed.
Are you hearing me?
Yes, we hear you, but I think you may not be able to hear us. All right, I know this has been a struggle for you. I was hoping we would be able to hear your voice. Yeah, but unfortunately, it looks like it won't happen. All right, so we're going to go back to François for his closing comments, and if I'm going to once again lower all the hands. And if you do have a final word before we close the session, we've gone way over time because you asked us to. François.
Dr. Sarawat, thank you for sharing your challenge and the cause of the challenge and how you're going to address it. I want to stress that you raise an important point is accessibility. You know, there's a tendency to accuse mothers or fathers or not to come to an immunization session, and putting the problem on the recipient when sometimes the services are not available. There's a tendency, and you put it high, that accessibility is critical before we accuse the recipients not to come. So congratulate to make this point clear. And the second thing, you mentioned the resistance because there's misinformation, conspiracy theory. And I think it's critical, I hope it will come in analyzing the cause of vaccine hesitancy, being very clear for each group has sometimes different kind of vaccine hesitancy, and you should dig in before you assume why, the reasons. And then you could tailor your communication to those reasons, the key reason you find on each group. Each group has different source of information, media information, and the doctors have a different, the health workers have a different question than the recipient. And you have highlighted all the stakeholders. I know how important in role plays the lady health worker. I met them, I saw them working, I work with them in Pakistan. You have chosen the right partner to get the message, but they need the information, they need the critical information too, before they can make an effective communication with the recipient. Thank you again for presenting your challenge and your actions.
Thank you, and I appreciate the fact that members of the movement have responded to the member who was having difficulties, who was told that they needed a formal letter from WHO, and several members have suggested that the data he is seeking is in fact available, publicly available. That's the kind of problem solving that is happening, that happened at least 3 or 4 times in the chat in today's session, and very much to the credit of the creativity and serendipity of the members of the movement. Thank you. I'm going to ask everyone to unmute, and if you can even briefly turn on your cameras so we can see before we go. And then next slide together will be among the assembly of the conference Accelerator.
Hello.
And those of you who are because you have not heard back from do not despair. We'll do another round of planning. People who have actually submitted actual plans working in the accelerator.
I'm happy to be here
for sharing your experience.
Nice meeting you. Hi.
Hello, everyone.
Hello. I'm happy to be here.
Hi, everyone.
Bye-bye.
All right.
I guess mute was the better option.
I can't wait.